Next up, we are pleased to have with us Dr. Laura Geer. She's an associate professor and chair of the Department of Environmental and Occupational Health Sciences at the State University of New York, Downstate Health Sciences, and the University School of Public Health. Dr. Geer's ongoing research focuses on the characterization of maternal environmental exposures and associated birth outcomes in ethnically diverse urban immigrant populations, including a focus on exposure to metals such as mercury and chemicals in consumer care products.
Thank you.
First question for Dr. Geer. So I understand you've been working with other researchers and some at Pure Earth in developing a new tool to estimate lifetime impacts from childhood lead exposure, and it's called the LERIC model. Can you explain what this is and walk us through this?
Yes, absolutely. First, I just wanted to say I'm very honored to be here with such an esteemed panel of women researchers, and I'm learning so much today. Very thrilled. And I'm also happy to share some of the ongoing work that Angela just referred to from our lead exposure reduction and impact calculator, or LERIC, which combines lead biokinetic uptake estimates for relevant childhood lead exposure pathways with country-specific economic data to generate the costs associated with lead impacts from IQ decrement. And here's just a snapshot of the user interface with our LERIC instrument, which is ongoing in terms of development. So on the left side, you see the yellow boxes where the user inputs the following characteristics about their population of interest, including whether it's an adult or child, the number of individuals in that population or the size of the population at risk, and then below that, the LMIC region or in country of interest. So those are that particular box there, the WHO region and country, are pre-populated pull-down menus for the user's convenience. And you'll see below that, once you input either the exposure pathway via soil and dust for the child, or there's another sheet that shows where you can input dietary inputs, you get an estimated blood lead level. So this tool contributes to some of the efforts around estimating impacts through IQ, because we've gone a couple steps further to model pathways for exposure to the children. There's also a portion, an interface. There are basically 3 tabs in the model where you could just go directly from blood lead or BLL values, because sometimes those are the only levels that we have that can kind of indicate exposure and dose in some of our low and middle income countries for this model. So then on the right side, we combine it with economic data we use a cost of illness approach. So we're combining information from these country specific economic values, GDP, life expectancy, we estimate lifetime earnings that are country specific, so we can come up with pre and post impacts based on blood lead, then IQ decrement, and then costs associated with each IQ point lost that are country specific. So we can kind of compare and use this as a very practical economic tool to look at various aspects that we would want to utilize this type of tool for in terms of pre and post intervention, which are, these are some of the projects that Pure Earth is directly involved in to look at the value of engaging in remediation programs.
Okay, thanks for that overview, Dr. Geer. So is this available for other researchers to use?
We have gone through several iterations of this model, and we actually engaged some of the country managers. It was really exciting through Pure Earth to come with their inputs and make some, do some runs on our tool. And so that was some of the earlier pre-testing of the tool. We did make it available, but we've been more recently updating the lead biokinetic uptake portions of the model with US EPA's most recent all ages lead model, the AALM version 3 values. So we just wanted to get the model available for researchers and our country representatives to use when we had incorporated some of the most up-to-date features because the AALM has many advantages over the prior IEUBK model for our applications.
So it sounds like it's in kind of like a beta testing phase and continuing.
Absolutely. And for those who are interested, please be in touch through Pure Earth because we can invite you to, the presentation when we have the official release and we really want people to go out there and test and use the tool and continue to give us feedback.
Okay, great. So, slightly different question. So what was the impetus for creating this tool and how can it be useful for policymakers or funders who are involved in the lead space? Like, what's your take on that?
Sure, that's a great question. So we've designed the tool to provide policymakers with these really practical and reliable estimates of the cost of lead exposure and associated impacts, and in mainly for site prioritization, for remediation. So accessing a tool that has these pre-built-in country-specific features of the economic input variables with what a country manager would come to this or a policymaker with specific exposure scenarios and the populations of interest that they can easily and readily put into the tool. And so some of the applications or utilizations of this data would be to perform cost benefit analyses, consider performing remedial projects, demonstrating benefits of a remediation in terms of pre and post intervention BLLs that could be put into the tool to look at the economic impacts and to calculate benefits of any proposed actions. And currently, the tool gives this IQ-based impact, but future iterations are queued up to potentially incorporate other health outcomes, including cardiovascular impacts.
Okay, thank you. That's very helpful. Okay, so switching topics slightly. So people who are aware of Pure Earth know that in the last 5 years, we've focused exclusively on reducing lead and mercury exposure. And Dr. Geer, among the many toxins that you've studied in your career, mercury has been a research topic of yours in the past. So can you briefly describe some of your past research and give us kind of a toxicology overview of the health risks from mercury exposure for women and children?
Sure, absolutely. So we know that mercury can pass the blood-brain barrier, transplacental distribution. And so fetal development is a very precious time for the developing brain. And, that's one of the target areas for mercury's impacts. So we engaged in a study in Brooklyn with looking at mercury exposure pathways in a predominantly Caribbean immigrant community. And we looked at, by way of a questionnaire, we looked at maternal urinary levels and cord blood levels with maternal child pairs. And we found just some interesting results that I'm sharing here is that higher gestational fish consumption and foreign birth of the mother were associated with higher cord blood mercury in the babies. And this is quite interesting. And it really demonstrates quite clearly that the cord blood, the developing fetus is exposed to the mercury quite readily. And the cord blood mercury level is a very efficient way to determine this prenatal exposure, and it really indicates exposure to the developing brain quite readily. And so a type of study like this is really indicating that healthcare providers, our public health agencies, community advocates really play a big role in helping to educate women of childbearing age about the predominant mercury sources, and in the case of just within the US, by way of seafood consumption during pregnancy, because that's the most efficient way that we're going to be exposed to mercury, and in particular during pregnancy. So we have these fantastic aids that we can use to talk about which fish are recommended to be consumed during pregnancy for all the positive benefits that support the development of the brain in the developing fetus, but then also some of the fish selection choices that could put the mother at risk for delivering a dose of mercury to the developing fetus. And so there's some very clear choices here. But what was interesting in our study is we found that some of the fish in this choices to avoid chart here were some of those that were pretty important to sort of cultural celebrations and practices in some of the Caribbean immigrant communities. So we found that really we needed to think about targeted interventions and to really make sure that these fish advisories were and consumption recommendations were getting to the populations that could really benefit. And how this relates to sort of the international setting of mercury, and I'll be talking a little bit about it in just a second. It relates because it's such a predominant source of exposure, the seafood pathway, the fish and seafood pathway. And so there are some sort of more simple ways that we can communicate risk and really alleviate some of the effects of mercury. And Angela, you had asked about toxicity. What are some of the targets? And I've been talking about the developing brain, and we've learned about that through unfortunately some poisonings that have happened more historically with there was methyl mercury released into a waterway in Minamata, Japan, and it led to a congenital disease characterized by these neurological problems, including intellectual disabilities, coordination issues, and developmental delays in the children. And another thing, I was doing some reading about Minamata and some of the impacts, and they were finding some altered, interesting sex ratios of the offspring, and the babies were born predominantly female. And what was interesting is they were trying to sort of figure that out, and they realized that quite a few stillborn babies happened to be male, so that accounted for some of the findings in terms of those ratios that were a bit off as what would be expected for those trends. So
Right.
those are just some interesting findings when a community has experienced severe poisoning of the food supply by way of it going into the waterways and bioaccumulating up the food chain. And then there was also an Iraqi cohort that was poisoned by way of methyl mercury being applied to the grain
Right.
as a disinfectant. And so we've learned a lot in terms of impacts, the prenatal exposure pathway, impacts on the outcomes, developmental and neurodevelopmental delays of the children from, unfortunately, some of these tragic events through poisonings.
Thank you, Dr. Geer.